Hi, I'm Michaela.
And I'm Carmen.
And we are registered dental hygienists with Clay County Public Health Center. Thank you so much for viewing this presentation. We are excited to be partnering with Midcontinent Public Library, and today we are going to be talking about prenatal and infant oral health. We are going to be talking about pregnancy and dental care, and also how to take care of your baby's teeth. So let's get started.
We're also going to be here live in the chat, so if you have any comments, questions, post them below.
Did you know that your baby's teeth start to develop when just 6 weeks gestation? That's really early and very critical because most women don't even know that they're pregnant around 6 weeks, or they just recently found out. Also, by 4 months gestation, hard tissues such as enamel are already forming below your baby's gum line. So early on, it's very important that we're eating healthy, taking care of our bodies, and the nutrition helps our baby as well. So let's talk about some myths. The first myth that I hear is pregnancy does not affect your mouth. Pregnancy affects our whole body, including our mouth. So due to hormone changes, pregnant women are more at risk for cavities, bleeding gums or gingivitis, and periodontitis or gum disease. So let's talk about each of those. Cavities are a change in our diet, or happen because of a change in our diet. Typically with morning sickness or food cravings, we tend to eat more carbohydrates and more sugars. What happens is when we eat those carbohydrates and sugars, over time, repeated exposures of that, an acid forms in our mouth. That acid can burn away at the enamel in our tooth and form a hole called a cavity. And in fact, children who have mothers with cavities are more likely to be at higher risk for developing cavities themselves. We'll talk about that more here on the next slide. So ways to prevent cavities while you're pregnant is we want to make sure that we are brushing 2 times a day, morning and night, that we're using a fluoride toothpaste. Sometimes that can be controversial to some people. Another option, a more natural option that I would recommend would be a xylitol product. You could use it in a toothpaste, mouthwash, mints, gums. The important thing about xylitol though is you need to have 3 to 5 exposures a day for it to be effective. And the way that xylitol works is it helps to eliminate the bacteria that would cause the cavity, versus fluoride helps to strengthen the tooth so that a cavity is less likely to form. So xylitol is another option if you want to go more of the natural route, but make sure that you have an exposure of 3 to 5 times a day, using a toothpaste 2 times a day, and then maybe a mint or a gum. And then also we want to watch our diet, make sure that we're decreasing those carbohydrates, decreasing those sugars, and then also visiting the dentist. We'll talk about that more here in a minute as well. Bleeding gums and gingivitis. So this affects a number of women who are pregnant. Even myself as a hygienist, when I was pregnant, I experienced bleeding gums as well. It affects roughly 60 to 75% of pregnant women. And women who had gingivitis prior to pregnancy are more likely to have even more of an increased response to this. So why does this occur in so many pregnant women? Well, the plaque and bacteria that is along the gum line will inflame the gums. And because of hormone changes and decreased immune system, this response, this inflammation, this bleeding just happens quicker, it's more sensitive. And so when you might not have had bleeding gums prior to pregnancy and then now it's happening, it can be a little concerning, but continue to brush and floss, remove that bacteria that's along the gum line and in between your teeth, and also get regular dental cleanings. Let's talk about periodontitis or gum disease. So this can actually be very serious, not just for your health, but also your baby's health. So what happens is destructive bacteria begins to destroy the supporting structures of the teeth. You can see here in this picture that there is little lines coming around the tooth. So that is called the PDL, or the periodontal ligament. And you can think of it as springs holding in a trampoline. So just like if we were to lose those springs of a trampoline, the trampoline wouldn't work, you would lose that. And the same thing happens with your tooth. You start to lose those springs, those supporting structures, and the tooth will become loose and can eventually fall out. Where this becomes a problem for your developing baby is that studies have found that that oral bacteria, that destructive bacteria that is around your tooth, has also been found in amniotic fluid and placentas. What happens is when that bacteria is in those areas, an inflammation response happens in the body, which can cause preterm birth and low birth weight. And we know that there is a variety of issues that can happen with both of those things as well. Myth number 2, dental cleanings, x-rays, and fillings are not safe during pregnancy. So this was a very common thought prior to around 2010, 2011. Many dentists were hesitant to treat any pregnant women. They wanted to wait until after their pregnancy to do any cleanings or x-rays, or if they needed fillings, they were going to wait until after pregnancy. However, studies show that it is so important because of these reasons that we're discussing, that pregnant women need dental care during their pregnancy. They need to have a healthy mouth and healthy teeth. So OBs, doctors, dentists, other health professionals all came together and came up with this consensus for dentists and OBs and other health professionals as well to safely treat pregnant women. And what they found through all this research is that most treatment, whether it's dental cleanings, x-rays, or getting treatment, was all safe during pregnancy. Getting anesthesia, so a shot before a filling, that is safe. The only thing that they kind of found that was a little bit of a red flag is they don't want to do the nitrous oxide or the laughing gas. It is important to always tell your dentist if you are pregnant. Even if you're early in your pregnancy, please let them know that. That will just help for them to determine treatment plans. Also, the most ideal time to have any treatment or cleanings done during pregnancy is your second trimester, and that's mostly just for your comfortability. Myth number 3. Bad teeth run in my family, so my baby will have cavities too. I want to stress that cavities are not genetic. Just because you might have had bad teeth or even your mom had bad teeth, that does not mean your baby has to have bad teeth. Through proper oral health education, which is what you're doing right now, viewing this presentation, learning about how to take care of your mouth and your baby's mouth, and routine dental visits, your baby can have a healthy mouth. So break that cycle. If this was you, if you had bad teeth and it's quote unquote runs in your family, break that cycle. Give your child a healthy mouth from the start. And there's a few ways that we do this. Obviously, knowing how to take care of their teeth, brushing, flossing when at an appropriate age, and visiting the dentist. Very important that we do not share utensils. Don't lick the pacifier and put it back in their mouth. Don't share cups, forks, and spoons. And then this is the hardest thing, but do your best not to kiss your baby on their mouth or lips. If you have bacteria that causes cavities or gum disease in your mouth, when you kiss your child, that bacteria can and will spread to their mouth, and that is how children are more likely to develop cavities or gum disease in the future. We're going to talk specifically more about how to take care of your baby's teeth. Carmen's going to go over that in just a while. So I hope you learned something new about your pregnancy health and taking care of your teeth, and Carmen's going to discuss how to take care of children now.
Great, thanks, Michaela. So our children's oral health starts with day 1. Our children are unable to take care of themselves, and they need someone, our caretakers, to do that for them and teach them how to as they grow. So day 1, begin wiping your baby's gums. You can use a clean cloth, a clean damp cloth, or an oral care wipe. You can find them at Walmart, dollar store, pretty much any home care aisle, a dental home care aisle. We recommend that you wipe your baby's gums after each meal, but we understand, especially if you have more than one child, that it's pretty hard to do that because child is feeding throughout the day multiple times. So if you can get in there and wipe the bacteria, the plaque and bacteria out of your child's mouth at least 2 to 3 times a day, that's disrupting the bacteria process to prevent future cavities once the child's teeth comes in. Once the first tooth does erupt, that's whenever we'll start introducing a small, soft, child-sized toothbrush. And you can use toothpaste with fluoride in there, just about a smear or about the size of a grain of rice. Dental professionals recommend all children to start using fluoridated toothpaste once that first tooth does erupt. We monitor the toothpaste and brushing until at least age 8. They really don't have the motor skills to brush properly. Brushing is a 3D action. As a child's developing and learning in school, they're learning to write, they're learning to cursive write, and cursive write is only a 2D action. So if you can imagine an 8-year-old cursive writing, if they can barely do that, then they cannot care for their teeth properly. So maybe at age like 4 or 5, whenever they're wanting to start that independence of brushing on their own, they can do it in the morning, and then at night, the parent definitely monitor the child and brush. We also recommend the first dental visit to be at age 1. This may be a little different than 10, 20 years past thinking because insurance was only paying for 5-year-olds and older, but that's not the case. We want the child to get into the dental office as soon as possible to establish that relationship with their dental provider. So even if it's taking your baby on the chair up and down or giving them a sticker, we're going to make a happy visit for your child, getting them comfortable going into the dental office. All right, so we're going to have a little fun and read a story. So grab your children, if you have them, and we're going to read Dr. Rabbit Meets a Brusholotomist. All right, Dr. Rabbit Meets a Brusholotomist by Colgate. Hello, I'm Dr. Rabbit. I'm a dentist, you see. To take care of their teeth, all the kids visit me. I just met a new friend, and he'll be your friend too. Brushy Brusholotomist, he's glad to meet you. Brushy moved to Tooth Town, and in a short while, it was time for me to check his clean and bright smile. So Brushy and his mom set out one spring day to come to see me, but they soon lost their way. They made a wrong turn onto Sugar Snack Street, lined with snacks and with drinks that were sugary sweet. When they got to the corner, his mom said, "Oh dear, I don't think Dr. Rabbit would be around here." Can you all see some of the sugary items on this page? Do you see the icing and the candy? Do you see the chocolate syrup ice cream cone and the cookies? Do you see the cupcake? All of these foods have lots of sugar in them, and they are not good for our teeth. Brushy knew right away they were on the wrong street. That sugary stuff wasn't healthy for his teeth. "Are you lost?" called a voice. Brushy's mom said, "Oh yes, we must find Dr. Rabbit. We have his address." "Dr. Rabbit," said Kim. "I was there yesterday. We all know where he is. We'll take you right away." "I just had my checkup. Come on, follow us." They were happy to meet a brusholotomist. So Brushy and his new friends, Kim, Anna, and Zach, all munched on some healthy apples for a snack. They skipped down the street and they all took a ride down the good for your teeth Super Glide Fluoride Slide. Fluoride protects teeth. It protects everyone. Brushy slid down the slide and said, "Wow, this is fun." Later that day, I heard my doorbell chime. Brushy and his new friends were right on time. Before we go on to that next page, I want to stop and point out all of the healthy items we see. Do you all spot the carrots in the background? We have a cherry, an apple, orange, milk. These foods are full of lots of vitamins and good and healthy for our teeth and body. So when Brushy got to the dentist could see right away Brushy knew how to brush front teeth and back teeth. There's no need to rush. Brushy's smile was so bright, I was happy to say, keep brushing with fluoride toothpaste twice a day. Be sure that you brush after breakfast, I said, and be sure you brush your teeth before bed. Brushy knows if you take good care of your baby teeth, it'll help your new teeth that are waiting beneath. Brushy and his friends know just what to do. They take care of their teeth, and you can too. One misconception is that baby teeth are not important, that we don't really need to focus or treat baby teeth if they do have cavities. And that is 100% not the case. Baby teeth are important, and they're important for multiple reasons. They're placeholders. They're placeholders for our permanent teeth, which are called our adult teeth, or more commonly known as our adult teeth. If we don't have those placeholders, our adult teeth will not come in properly. It's important for the child's development. Teeth are the chewing function, the first start of digestion in your child. So we need teeth to chew our food, to fuel our body for nutrition, and to learn how to speak. If you were to say the word tooth right now, you can feel your tongue touching your teeth when you pronounce words. So we need our teeth to speak. Children who are unable to care for their own oral health, like I said earlier, so continue to monitor them and allow them some independence around age 4 and monitoring up to about age 8. All right, we're going to do a fun nutrition activity. So one way to protect our teeth and keep them strong is by choosing healthy foods like fruits, vegetables, and dairy products like milk and yogurt. These foods don't have those added sugars in them. Instead, they have lots of vitamins and they're good for our teeth and entire body. Foods with lots of sugar in them, however, are not good for our teeth or our body. Whenever we eat these sugary foods, drink these sugary drinks, they mix with the bacteria that's in our mouth and are combined to make these sugar bugs. Sugar bugs sit on our teeth and start to dig a hole in our tooth. And when we have a hole in our tooth, we call that a cavity. It's an unhealthy tooth, it's a sick tooth, and we get that fixed by a dentist. But we can keep our teeth healthy by choosing the healthier items. So we're gonna play an activity right now. It's really important that you learn what foods are healthy for your teeth and what foods are not healthy for your teeth. So you can do thumbs up for healthy, thumbs down for not healthy. You can shout out because you're at your house and your parents will allow you to have fun with this activity. So the first item that we have are carrots. Are carrots healthy or unhealthy for your teeth? Our thumb should be up. Healthy, that is correct. Carrots are full of nutrients, vitamins for our teeth and our body, but also they're crunchy. And these crunchy foods, whenever we're eating them, they help clean our teeth, our gums, removing that plaque and bacteria. So we call these our food toothbrushes. So think of the healthy snacks between our meals to help clean our mouth and fuel our body. The next item we have is Coca-Cola. Is Coca-Cola healthy or unhealthy? Thumbs up or down? Yes, your thumb should be down. It is bad or unhealthy for us. Coca-Cola tastes really good, but what does it have lots of? Sugar, that's right. Coca-Cola has lots of sugar in there. Again, those cavity bugs love sugar. The next item we have is milk. Is milk healthy or unhealthy? Healthy, yes. We're going to place that inside the mouth. Now, if it was chocolate milk or strawberry milk, we're probably going to place that on the outside because we add chocolate syrup and strawberry syrup, which has lots of sugar in it. So white milk is good and healthy for our teeth and body. What about Skittles? Thumbs up or down? Thumbs down. That's my favorite candy, but they're not good for us. They stick to our teeth and they have lots of sugar. That's right. So outside the mouth. Next item up, strawberries. Are strawberries good for us? Are they healthy or unhealthy? Healthy, that's right. So we're going to place that inside the mouth. Strawberries are, again, lots of nutrients, and they actually help whiten our teeth. Next item, broccoli. Is broccoli good, healthy, or unhealthy for us? Thumbs up. Broccoli is good for us. The raw broccoli, whenever it's crunchy, is another one of those food toothbrushes that help remove the plaque and bacteria in our mouths. Next item, we have chocolate cupcakes. Thumbs up or down? Thumbs down. Unfortunately, cupcakes are really good because they have lots of sugar in them. A blow pop. Are blow pops good or bad for your teeth and body? Bad, that's right. So we're going to place it outside the mouth. It's okay to have sugary foods every once in a while. It's okay to have candy maybe for a birthday party or Halloween, or if you did something really well at school. But we shouldn't be having candy every day, and we should be maybe having a small amount of that candy as well. The next item I have is water. Is water healthy or unhealthy for us? Thumbs up, healthy. Water helps wash away the foods and sugars in our mouth after we eat. These next two items are not food items, but I did want to show them to your kiddos because we go into the schools a lot and we see a lot of kids putting their fingers in their mouth. Is this healthy? Should we be putting our fingers in our mouth? No, we should not be. We're then putting the bacteria on our fingers and then touching everything. We don't want to share germs. We don't want to share that bacteria. So keep your fingers out of your mouth. And the last item I have is a pencil. Now, most of you are probably pretty familiar with this item, and we see a lot of kids chewing on pencils at schools as well. Don't chew on the eraser, don't chew on the wood part, don't chew on the metal part especially. It'll hurt your teeth and not good for you. So place that outside the mouth. All right, if you all have any questions for us, please get a hold of us through our contact.
We hope you enjoyed this presentation that was brought to you by Midcontinent Public Library. We hope you learned something new about pregnancy dental care as well as your baby's oral health.
Again, if you have any comments or questions, put them in the chat box below. We'll be here for a few more minutes. If you have questions from the future, we have our contact information listed for you. Have a great day.
Take care.